The official March 31st deadline for enrolling in the Obamacare exchanges has passed. Today, many journalists were saying that the ACA has crossed the finish line and reached its goals, but some big questions remain. The administration has announced that over 7 million people have enrolled in the Obamacare exchanges. But this top-line number tells us very little about who has actually gained coverage under Obamacare and who will be able to afford coverage going forward. We don't know how many people who have gained coverage on the Obamacare exchanges were previously uninsured. Covering the uninsured was the whole point of Obamacare. It should be the standard by which it's judged. These numbers are in flux, but the most recent estimates show that between 1 and 2 million Americans who gained coverage on the exchanges were previously uninsured. For perspective, that's 2% of the 48 million people in this country without health care insurance. Instead, the vast majority of people signing up for coverage in the Obamacare exchanges were some of the 5 million people who had their previous plans canceled because of new Obamacare rules, or those who found that government-subsidized insurance was cheaper than their previous plans. We don't yet know how many young and healthy people have signed up for the Obamacare exchanges, and this is critical for making sure that health care stays affordable. The whole idea behind the individual mandate was that by forcing young and healthy people to buy expensive coverage they didn't need, this would help cover the cost of caring for older and sicker Americans. But basic economics shows us that most young adults will sit on the sidelines. The cost of health care insurance ranges from $1,000 to $4,000 for your average 27-year-old male. This is significantly higher than the cost of the penalty. With young people sitting out, insurers will have to make up the cost elsewhere, most likely by raising premiums and increasing deductibles. Trust is the foundation of any law. The administration has already made so many changes to Obamacare, including the recent delay of the March 31st deadline, which they promised was firm, that it's hard to know what's here to stay and what's not. Obamacare is as unpopular as ever. Only 26% of Americans support the law, and it will play a huge role in the 2014 midterm elections. Between now and then, we're likely to see many more changes to Obamacare as the White House provides congressional Democrats with political cover. The close of the enrollment period in Obamacare is a milestone, but it's far from the finish line. Incredible uncertainty remains among consumers and businesses, and it's not clear if Obamacare has accomplished its dual purposes of increasing coverage for the uninsured and reducing the costs of health care.